Option Grid and Picture Option Grid help facilitate shared decision-making conversations. They are conversation aids that compare different treatment options by presenting the best and most up-to-date research that answers frequently asked questions that people find most important. They have the same plain language text. We added pictures to Picture Option Grid to help people with lower health literacy. Option Grid and Picture Option Grid are designed to be flexible. You can use them before, during, or after a visit. If you use an option grid during a visit, it's a good idea to explain the layout of the tool. If you send an option grid to a person before a visit, make sure that they're given information on how to use it. There are templates available to you that you can adapt for your setting. Step 1. Explain it. Explain that the tool has questions that many people want answers to, typically around 6 questions. Answers to these questions are then given that apply to each option being compared. It might be helpful for you as a clinician to read one question as an example, and then point out how the answers to each option are different. Step 2. Give it. If you are using a paper copy, give the tool to the person you are speaking to and check whether they have something to write with. Suggest that they underline or write things down that seem important to them. If you are using a screen, make sure that they can see the tool, and offer to send them a version using the patient portal or by other means. If you're able to, print it out for them. Step 3. Use it. Pause. Encourage responses. Offer to respond to questions. Perhaps ask which questions seem most important to them. The goal is to try to help people make informed preferences. People may want more time to review the option grid, so give or send them a copy and make time to talk to them again.